All right, welcome. We are going to be talking about hepatitis viruses today. This is chapter 12. And I'm going to have this split into two videos. In this first video, I'm going to talk about the clinical course of hepatitis virus infections, and then I'll also give you an overview of transmission epidemiology of the hepatitis viruses. And then in the second video, I will cover the molecular virology of hepatitis. All right, so as I'm sure you're aware, hepatitis is just generally characterized as inflammation of the liver, and this can be caused by, abuse of alcohol, drugs, poisons, certain metabolic diseases. But what we're going to focus on here is there are, of course, hepatitis viruses that can also cause this condition. And the major hepatitis viruses are just simply named hepatitis A through E, abbreviated HAV, HBV, and so on. And, worldwide viral hepatitis is a significant cause of disease and death. So it is a substantial problem, even though, as we'll talk about, there are vaccines against some of these hepatitis viruses. So in addition to just causing hepatitis, in particular, the hepatitis B and C viruses cause the majority of liver cancer cases worldwide as well. And we'll get into this as we look at some numbers throughout this section, but there's hundreds of millions of people in the world that are living with chronic hepatitis infections. So in terms of the clinical course, you have an incubation period that can range from 1 to 3 months, depending on which specific hepatitis virus you're talking about. Then you have the prodromal period, which, as you may remember, is where you're just getting nonspecific symptoms, so feeling tired, nausea, vomiting, potentially maybe a low-grade fever, sometimes muscle aches, back aches. And then you have your specific symptoms in the illness period. That's going to begin anywhere from a few days to, a week or a little more after those nonspecific symptoms have begun. And here you're going to have abdominal pain, like your liver is going to hurt. You're going to have dark but clear urine. You'll get, what most people probably think of with hepatitis is the jaundice, right? The yellowing of the skin and the eyes, which is caused by a buildup of this bilirubin pigment. And that builds up when your liver is not disposing of red blood cells properly. You also get some gray-colored stool and an increase in these two enzymes, AST and ALT, in the blood. These are both involved with amino acid metabolism. And I mentioned chronic infections already, and we'll revisit this, but I just wanted to throw this in here up front because it really is typically like chronic infections that are going to be most significant. So hepatitis A and hepatitis E generally do not cause chronic infections. With hepatitis B, you will, in a low percentage of cases, 5 to 10%, although it is more likely in infants. Hepatitis C, a high percentage of those cases do become chronic. And hepatitis D, generally speaking, no, low percentage of infections will be chronic, but that jumps way up if you have what's called a superinfection, which is basically a second hepatitis infection. So you were previously infected and then were reinfected. That ups the chances dramatically with hepatitis D. All right, so brief clinical course, basic symptoms. Let's talk some transmission and epidemiology. So as we're going to see, each of these, even though they all cause the same condition, these are distinct viruses, and they all do have their own distinct modes of transmission, portals of entry into the body. And this can be a challenge in terms of diagnosis, right? You can't just look at somebody and say, oh, you have hepatitis B or hepatitis C. You would actually have to do some lab tests checking for antibodies or doing some DNA sequencing, etc., if you really wanted to know specifically which hepatitis virus you were dealing with. So we're going to spend some time on this table, and I'm going to go through these hepatitis viruses one at a time. We'll do kind of the overview, I think is shown here in the table for each virus. I'll start by talking about that, and then I'll show you a few other slides, some maps, and throw some other numbers at you related to each one of these. So makes sense. We'll start on the left here with hepatitis A. And as you can see from the table, so this is primarily fecal oral transmission, right? So due to poor personal hygiene, or in developing parts of the world that do not have proper waste disposal. In terms of the incubation period, it's about a month on average. As we said, typically don't get chronic infections with hepatitis A. We have this distinction in the table between acute and chronic infections. An acute infection is going to be any infection that lasts, I believe, 6 months or less, whereas a chronic infection is more than 6 months. So you have, over 1 million people a year worldwide with acute hepatitis A. We already mentioned don't tend to get chronic infections. And a few thousand cases per year in the United States. And luckily there is a vaccine available against hepatitis A. So some of this I've already said. So rarely you're going to get complications with hepatitis A, although in some cases you can get prolonged periods of the jaundice. You can get relapses over the course of months, or usually not longer than that, because as we said, this is not going to be chronic. Occasionally you will see deaths attributed to hepatitis A, which are basically due to liver failure from the hepatitis. So we got some mortality numbers down here in children under 15 years old. 1 death per 1,000, 3 deaths per 1,000 in adults age 15 to 39, and in the 40-plus crowd, about 18 to 20 or so deaths per 1,000. So even at the high end here, you're talking about would be about a 0.02% mortality rate, so still quite low. And I mentioned I'll show you some maps in terms of the distribution of some of these hepatitis viruses. So hepatitis A, you do find it pretty much everywhere in the world, but it is very endemic in Central South America, Africa, Asia, parts of the Middle East, and also in the Western Pacific as well. And you're going to see this trend over and over again. Hepatitis tends to be a much bigger problem, in particular in parts of Africa and Asia, and maybe to a little bit lesser extent in Central and South America. So I mentioned there was a vaccine available against hepatitis A. This was first licensed in the mid-1990s. Didn't make it onto the childhood vaccination schedule until the early 2000s, though. But hepatitis A used to be the most frequently reported hepatitis in the United States, but once this vaccine was being more widely used, we've seen rates of hepatitis A drop off dramatically, as you can see down here in the graph. So in 2013, which is 10 years ago, and I haven't seen the more recent numbers, but I would guess they're similar, if not even lower at this point. Only about 3,500 cases in the United States. All right, then hepatitis B, we have a very different mode of transmission. So this is bloodborne, or through sexual contact, or in some cases perinatally, right, from mother to child. We've got a much longer incubation period here, averaging at 120 days. As we said, you will get some low percentage of chronic infections, although more common in infants than in adults. And you've got 4 million people worldwide with acute infections and hundreds of millions worldwide with chronic infections. So that's a huge number, 350 million. Again, less of a problem in the U.S., but still 5,000 to 8,000 cases a year. Luckily, there is a vaccine available against hepatitis B as well. So, almost half of the world's population lives in an area where there is high prevalence of chronic Hep B infections. And as I mentioned, and as we saw in the previous map again, this is most significant in sub-Saharan Africa here, but really, throughout Africa and good chunks of Asia here. And, we talked about the large number of chronic cases, but that's also leading to a large number of deaths every year. So some of those from the hepatitis induced by the infection, cirrhosis and liver failure, and as I mentioned earlier, liver cancer, right, being induced by these chronic infections as well. So as you saw on that map, with hepatitis B, very low occurrence in the US, Western Europe, Australia, but still, because you do get a substantial number of chronic infections with hepatitis B, right? So those are going to be long-term infections lasting years and years potentially. You do still have a large number of people, almost 1.5 million in the U.S. that are chronically infected, with about 5,000 to 8,000 new acute cases every year in the U.S. And because this is bloodborne, you see the risk of catching hepatitis B being increased by some of the same behaviors that you would probably think of that would increase risk of like HIV. So through sexual contact, through needle sharing, IV drug use, some of those kinds of things. So I mentioned there is a vaccine available, and because of that, we have seen a decline in hepatitis B cases. So you can see the number of cases here peaked in about the mid-80s and have been steadily declining since. And we think some of that may have been due just to HIV prevention efforts as well, because as we said, right, very similar mode of transmission. So I think HIV certainly, got more attention, got more press, right? People were really changing their behavior to try to not catch HIV, and that also had the effect of reducing Hep B cases as well. So the hepatitis B vaccine was added to the childhood vaccination schedule in the early 90s. It's a 3-shot series given starting at birth and provides a very high level of immunity, so it's a good solid vaccine. Hepatitis C, also bloodborne, can also be transmitted through sexual contact and also from mother to child as well. Got a little bit shorter incubation period, a little bit over a month compared to hepatitis B. Here you do have an even higher percentage of cases causing chronic infections, similar number of acute infections worldwide, and over 100 million, almost approaching 200 million worldwide chronic infections. And we do see a significant number of cases in the U.S., about 30,000 every year, and there's no vaccine available currently against hepatitis C. So the map here is not going to be substantially different. We're seeing a little bit of a shift to northern Africa, right? High number of cases through the Middle East and then into Asia again as well. And actually the highest prevalence is in Egypt, where they estimate about 10% of the population is infected. So I'm not sure exactly what's going on in Egypt, but it really got a foothold there for some reason. So focusing on the U.S., as we said, there are almost 4 million people in the United States that have a chronic hepatitis C infection, and many of those may not be aware of it because sometimes the first symptoms you have are not until the disease is much more advanced. They're estimating about 30,000 new cases a year in the United States, about 12,000 people dying each year of hepatitis C related disease. And hepatitis C is the primary cause of liver transplants in the United States, and I think worldwide for that matter as well. So we mentioned no vaccine. However, there are some good antivirals that can be used against hepatitis C. So good, in fact, that you can actually get to the point where you really can't detect any viral load in the patient even after treatment has been completely stopped. And what they're showing in the graph here was kind of a peak in cases in the early 90s in the United States, which was when they started screening the blood supply for hepatitis C, because you could imagine if they're not screening, right, you could catch this virus by getting a blood transfusion, which we obviously don't want. So we've seen cases drop significantly since then, and you combine that with the antivirals, and we at least have some tools in the toolbox here, although a vaccination would be ideal. Hepatitis D, we're going to stick with the bloodborne transmission mode. In this case, you've got an incubation period of about 90 days on average. In the case of superinfections, which we discussed earlier, it's a little bit shorter. And this one, you do get chronic infections at a very low rate, but as I mentioned, much higher, to 80% if you have a superinfection. And in hundreds of thousands of people with acute infections and tens of millions with chronic infections worldwide. And this one is, luckily in the United States, is relatively unknown, so it's not really an issue in the US. And the hepatitis B vaccine that we already talked about will also protect against hepatitis D, so that's a bonus. So I won't show you the map, but you may get the impression from the fact that one vaccine can cover both these viruses. May not be surprising that the geographical distribution is very similar between hepatitis B and hepatitis D. And I already mentioned these 2 points. So then that leaves us with hepatitis E, and here in terms of modes of transmission, we're back to the fecal-oral route. We've got a little over a month in terms of the average incubation period. You're not going to get chronic hepatitis E infections unless you're immunosuppressed. We've got about 20 million acute infections worldwide. As we said, very rare that you're going to see a chronic infection. This one is also very uncommon in the US, and there is a vaccine, but at least at the time, a few years ago that I put this slideshow together, it was only approved for use in China, being developed in China as well. And you could see from the map why China would have been pressing for such a vaccine, right? So again, lots of hepatitis E in Central America, really all throughout Africa, and then throughout Asia and the Middle East for that matter as well. So I will stop there, and we will pick up with some molecular virology in the second video.